It's our 6 months leadership series as part of Resilience Reimagined. And today I'll be moderating the session. My name is, for those who don't know me, my name is Dr. Iuliia Hoban. I lead our M.S. in Human Security and Resilience program within the Department of Emergency Disaster and Global Security Studies, and Dr. Corbin, the department chair, is here. So it's exciting also to have Jen Osetek to present today during this session. And I will also say, with the coincidence, this term I'm teaching Introduction to Human Security, and this week we're looking at the health security as one of our topics. So I'm glad to see some students here. It's very relevant to what we study every day, and also to practitioners as well. Couple notes, housekeeping notes. We will end this session at 1:50 sharp. So please make sure you add your questions to the chat so we can have probably 10 minutes of Q&A in the end. And as we begin, you also can share your name, where you're joining us from, and your affiliation if you're inclined to do so. So it's my pleasure to introduce Dr. Jen Osetek, and I will start with a short introduction. Dr. Osetek is an assistant professor of public health sciences at Penn State University, College of Medicine, where she also serves as director of graduate education in public health preparedness. Her teaching focuses on public health preparedness, critical infrastructure protection, and the non-medical obstacles that can affect effective public health response. In addition to her academic role, she works as a senior consultant with Dynamo Technologies, where she supports Coast Guard's Office of Specialized Capabilities in Washington, D.C. Dr. Osetek also contributes to the Countering Weapons of Mass Destruction program, with a particular emphasis on biological and chemical response, so which will be also the focus of today's presentation. And Dr. Osetek also is a commander in the United States Coast Guard Reserve, and currently serves as a senior reserve officer at Sector Charleston, South Carolina. She earned her Ph.D. in biodefense from George Mason University's Schar School of Policy and Government, and where she was named the 2018 Outstanding Doctoral Student in Biodefense. So I would like to welcome Dr. Osetek and her presentation today that focuses on public health aspects of recovering from Shinrikyo Tokyo attacks, and I probably butchered that, so I will let her to properly name the topic. And welcome, Dr. Osetek.
Thank you so much. Thank you for the introduction, and also for the invitation to come speak today. I'm really excited to be able to speak as part of your series. And this is a topic that I think is really interesting because it does tie in like a chemical threat to public health and public health preparedness, but it also is it's just a really interesting case study, as I hope you'll see as we go through this. So, okay, perfect. It'll be really interesting once I can move the slides. So, Shinrikyo was a cult in Japan. The name means supreme truth or teaching of the truth. And it began in the 1980s, and it was a mix of Hindu and Buddhist beliefs, sorry. And it eventually started to morph into having a lot of Christian beliefs about the apocalypse. And the leader, Asahara, was thought to be like a version of Christ, and also the first enlightened one since Buddha. The Japanese government did recognize the organization as an official religious organization when it was about 10 years in. And at its peak, it did have tens of thousands of members across multiple countries, including the US. So, as I mentioned, a big part of their beliefs was involved the coming of the end of the world, but the specifics around that belief kind of morphed through time. So the central idea was that the end of the world was near, but then first Asahara and his followers were the only ones that could stop it. And then the thought was more that only the followers of Shinrikyo would survive. There was also a belief that the US was going to bring about Armageddon by starting World War III with Japan. And then there was also a belief that Shinrikyo could use bioweapons to bring about, if the apocalypse was going to happen anyway, instead of waiting for the US to do it by starting World War III, then the cult could bring it about using bioweapons and kind of be ahead of it and be leading how this was going to go. So it was, as I mentioned, a religious organization, a religious cult, but it rose to power and it was a very organized organization. Some of the ways that it became so powerful and so well equipped was that it did run electronics businesses and restaurants. When people did join the organization, they turned over their estates, they severed ties to families and friends, which was very upsetting because a lot of the people that were recruited were young university students and recent graduates that came from elite families. So their parents were upset. So they had these youngish kids, college graduates. So college students, college graduates that were leaving their families and joining this organization, looking for a meaning in life. And Shinrikyo bought plots of land to establish what they called lotus villages, and they would isolate the members away from the families that they had left and the friends that they had left behind. So these young people did get the meaning in this organization that they were looking for, but it was a pretty tightly controlled environment. And as I mentioned, it was very well organized. So as you can see on the right side of the screen, it was organized into like ministries, like the government of a country would be. And you had everything from defense and education to health and welfare, intelligence, justice, S&T. So it was very well defined and very well organized, which did lead to some of the success that they had. So as they got closer to these apocalyptic thoughts, there were a number of things that were going on. So they did believe that the US possessed weapons such as plasma guns that could atomize bodies, huge space-based mirrors that could reflect and direct the sun's rays, earthquake generators. So with the belief that we had all of these and that we were going to eventually be starting World War III, a way that they were able to counteract, that they hoped to counteract this, was they bought land in Austria looking for uranium so that way they could make nuclear weapons. And they also bought old Soviet weapons to try to make their own in their Japanese base. And these programs were often plagued by a lot of technological challenges because obviously building nuclear weapons is not easy. Luckily, it's not very easy. And also, the members of the organization that were involved in this had pretty short attention spans. And when things didn't work, they really didn't stick with it much. They would move on to the next challenge or the next idea, which again, from our perspective, that's not a shortcoming. So the bioweapons aspect was something that I found really interesting, and it was the most extensive non-state bioweapons program that one of the most extensive ones that we've seen. And it was one of only two non-state efforts to try to manufacture and disseminate aerosolized bioweapons, and they were specifically interested in the bacteria that causes anthrax. So um, at one point, there was somebody that the organization wanted to murder, and they were looking for something that was very, very effective, and they wanted to use botulinum toxin, which is what you use in Botox. And they looked at that as a murder weapon, but then realized that you can use it on a much larger scale. So they decided that they were going to try to cultivate it from soil, which as you're going to see with a number of their efforts, luckily they took the more self-motivating, self-reliant way instead of what could have